As used in the clinical laboratory sciences, the term phlebotomy means the collection of blood. The most common phlebotomy method is venipuncture, the puncturing of a vein. The larger veins used for venipuncture are close to the surface of the body, most commonly the large veins found near the bend of the elbow. The risk to the patient in venipuncture is a bruise, a hematoma. However, you are always at risk of acquiring a blood-borne disease from the patient. This can occur from a needle stick injury when obtaining the specimen. You can protect yourself by using the correct technique, following safety procedures for any equipment, and immediately disposing of used needles in a rigid biohazard waste container. Blood is often collected in evacuated tubes. The vacuum in the tube pulls in blood until the tube is filled to the correct level. This method is fast and poses minimal risk of exposure to blood-borne pathogens or needle stick injury, especially when needles with safety devices are used. The method is most appropriate when the patient has a large vein, because the force of the vacuum can collapse a small vein. Evacuated tubes have different additives in them, and it's important to select a tube with the correct stopper color for the test that will be done. A tube with a red stopper has no additives, so the blood will clot. Red top tubes may be used for blood chemistry tests and serology tests that will be performed within an hour. If the blood cannot be tested within about an hour, the blood cells may cause chemical changes in the serum. This is a serum separator tube. It contains a gel additive. When the sample is centrifuged, the gel separates the serum from the blood clot. You may also use a tube with an anticoagulant to keep the blood from clotting. You'll use different additives for different tests, and these tubes are also color-coded. If you are using more than one type of tube, it's important to minimize the impact of the contamination of a sample with a small amount of the additive from the previous tube. You'll do this in two ways. Correctly position the patient's arm so that the stopper is the highest part of the tube. This helps prevent release of additive. Follow the recommendations for the correct order in which to draw samples. Do not use an arm for venipuncture if the patient has had a mastectomy on that side. This could cause poor lymphatic drainage and fragile circulation. Do not use an arm for venipuncture if the patient has a shunt or fistula for dialysis in that arm, because the tourniquet could cause a problem with the shunt or fistula. Avoid performing venipuncture in an arm with any other condition that could interfere with blood circulation. The Occupational Safety and Health Administration, OSHA, requires employers to use safety devices to reduce needle stick injuries. These are activated immediately after the sample has been obtained, so that the tip of the needle is no longer exposed. For this skill, you will need disposable gloves, a tourniquet, an alcohol wipe, a double-pointed needle, a plastic holder, evacuated tubes with labels, a sterile 2x2 gauze pad, adhesive bandage or tape, and a rigid biohazard sharps container.